what we do is extremely important because this is public safety. This is the point where people are having the worst day of their lives, and they don't need to worry about the quality of the care that they're going to receive when they call for help. And that's our job, to make sure that whenever somebody calls 911, that the person or people that show up to help them are trained to the highest level and capable of providing the highest possible quality emergency care.
For over 40 years, Regions Hospital EMS has partnered with public safety agencies to make sure our communities don't have to worry about what happens in an emergency. We work with agencies that represent the entire spectrum of emergency medical care. We specialize in customizing our services to meet the unique needs of each community we serve.
Here at Regions, we have a fabulous team, and I think that's what makes the difference. It is the people, it is their expertise, but it's their passion and their compassion for who they work for and the communities they serve. And that's at all levels. From the first time you walk through the door here at the Regions EMS office to the encounter you have with the paramedic and the clinical supervisor, as well as the medical director who shows up at the scene in order to assist the community providers.
Having an active physician-led emergency medical services department allows us to bring the expertise from within Regions out into the community. We see this with pediatric trauma, with our cardiac and stroke care, with our burn and trauma programs. It allows us to bring the expertise that happens every day here in the hospital out into the community.
We believe that education is one of the most powerful tools we can use to influence the care our community's citizens receive.
Regions EMS provides education in a variety of settings. So we have students here at our classrooms, at our office, and also off-site at different remote locations, maybe at their ambulance service, somewhere else in their community. We provide simulation, scenarios, many different varieties of active learning. We have video-based and other online education modules that we also offer, as well as critical case review and critical thinking labs where the medical directors are interacting directly with providers for the education session.
At Regions EMS, we believe that education should be guided by clinical feedback through quality assurance. Utilizing a combination of peer review, scene response, and real-time data analysis with state-of-the-art technology, we are able to provide timely feedback to identify and correct trends before they become issues.
You know, if there's any questions, we have a professional that we can refer back to say, okay, you're a professional educator, where did we miss, or where did we do really well? And if we needed to upgrade those skills, how are we going to be able to do that? So they actually see us in action, recognize that fact, and give us points on either how to get better or compliments on what we did very, very well.
Supported by the Regions Hospital Critical Care Research Center, we are able to conduct cutting-edge research into emerging medical devices and therapies.
Regions EMS is very progressive in their research projects, and we've participated in a number of those research projects.
Regions EMS has a dedicated staff to manage all of your supply chain needs, including medical supplies, oxygen, and pharmaceuticals. We provide controlled substance accountability, competitive pricing through Health Partners purchasing agreements, and next-day delivery direct to your station. Regions EMS has a presence at many prominent community events throughout the East Metro to ensure seamless care between the event and the local EMS agency. Our event medicine team provides BLS, ALS, and even physician-level care at venues such as the Xcel Energy Center, CHS Field, the Minnesota State Fair, and other large music festivals and athletic competitions. Our team can help with medical resource planning, emergency preparedness, and on-site logistics. We feel that as a healthcare organization, we have a duty to improve the health of the communities we serve. We also believe that public safety agencies are strategically positioned to recognize the unique characteristics of their community and identify areas for intervention.
We believe that community paramedicine provides a means for a community to respond to the gaps in healthcare that exist in their community in an innovative way. EMS has traditionally been the safety net for a lot of patients in our communities, and community paramedicine really allows us to take that next step and fully integrate the EMS system with the healthcare systems that are in your community.
Community paramedics can be very effective at keeping patients out of the hospital and can markedly reduce unnecessary visits to the emergency department as well.
The benefit of working close with Regions EMS is that we're familiar with each other. We have a working relationship already as medical directors.
We don't operate an ambulance service, but we do everything else to make sure your agency operates at the highest level, ready for any emergency that might take place in your community. We firmly believe that critical care begins in the street, and this drives everything we do. At Regions Hospital EMS, we are your one-stop shop for all things EMS.